was really important for us to reach people who didn't understand food and didn't know what to do with it, because we could see that it was negatively affecting their health.
In your neighborhood, you only have, just fast food, and then when you do try to go eat right, it's expensive to do it. Even if you go to the store and try to buy, fruits there, once you go to that scale, you're like scaled out. You can't afford it.
We found that in the past couple years, especially once we started doing a delivery service, that we had to really pay careful attention to what was happening with people, because we see certain areas, you have people who have high rate of cancer, high rate of diabetes, high rate of hypertension, and you look around the area and you realize it's because they don't have a supermarket and because they don't have access to fresh fruit and vegetables. We've started really tailoring our business to areas like that, where we can go in and be a really good resource for them. We make special packages for them. Like, we know what we can include and we know the things they need more of. And then, they'll call and they say, my numbers are down this week and I went to my doctor, my checkup was great. I know it's because of what I'm doing with you. And with us, they're able to taste all these things. They're able to pass on this to their kids, and their kids are saying, oh, I prefer to have this now instead of the junk food.
When people see us in the hospitals and they see that they can get this amount for this much, they're amazed, and they're like, I could actually do this. And then they find out they can come back 2 weeks from now and do it again, and they're like, oh man, I can actually keep this up. The investment has enabled us to do so much with our advertisement, has been able to expand it. Basically, we've been able to expand our growth and be able to help people in further regions that we couldn't reach before.
So now we can comfortably say that we can go 60 miles outside of Atlanta doing deliveries, because we know that these are the areas that need it, and it's something we can manage. It has increased the possibilities for us, and we've been able to execute things where we knew it would be possible. We just didn't have the legs, and y'all gave us the legs.
The inequities in our food systems compound other injustices already experienced by Black, Indigenous, and people of color communities. The American Heart Association's Bernard J. Tyson Impact Fund addresses food insecurity holistically by investing in organizations, social entrepreneurs, and farmers that are working to increase access to fresh, healthy foods.